I'm Dr. Berry, licensed psychologist, and here I share normally on legal topics and sometimes entertainment. Today, I wanted to take a step back. This past week, I work with a lot of federal workers. I work with people that are connected to government contracts. And there's a lot that's been going on in the last few weeks. And so I wanted to put out a video for tips and resources and tools for people that might be struggling with the overwhelming amounts of change and news that's coming forward. The one thing I will say is that um, there are challenges to some of the agreements. So let me share my screen for anybody that has no clue what's going on. OPM, which is the Office of, I think it's Office of Personnel Management, but it's an organization that oversees all federal workers. They put out an email, I think it was like at midnight on the morning of, I think, the 28th or somewhere around there. I know because in my community group, somebody asked if anybody had seen this. And if you go to OPM's website, Fork in the Road email, that is something that was sent out from HR and sent out to all federal employees, yes, on January 28th, presenting an offer to resign. And this email brought up a lot of uncertainty for people because in the email, it says that if people do not accept this offer to have paid leave through September, that their job could be at risk. And so if they did not take this offer, that there's a chance that some people might be terminated and not have this potential, this option. And the goal of this was supposed to be that it was going to weed out that our workforce is too large and that federal employees are this and that. But what it's done is it's really hurt the morale of federal employees because my mom worked for the federal government for, I think it's over 30 years, possibly like I think it's definitely over 30 years. And she said the people that take this offer are most likely going to be the people that can easily get a new job. The people that accept this may be some of the best workers and the workers that are considered, because there's this stigma, I think, within the that like some federal workers don't do their job because this wasn't targeted to people that weren't doing their job or to people that weren't reaching certain performance metrics. This was sent out and this was an offer that was given to anyone. And then I think a lot of agencies had to then say, because I think the VA put out something saying there are certain jobs where people can't do this because let's say a bunch of staff at the veterans assistant the VA, let's say they all resign, that can impact the medical services available for our veterans. And so um putting the grant funding and the all of those things on hold, there are people that are concerned about being laid off, about all of this, and it's feeling incredibly hectic, and a lot of offices are holding meetings to try to figure out how to comply with the current orders and with the direction of the current administration. And with all of that, um, I'm really concerned about increasing anxiety and stress because the people I'm seeing are feeling demoralized, are feeling as though their government and people high up do not care about them. And that was a hard thing to support this past week because normally as a therapist, we are challenging irrational thoughts. So, if I'm working at a job, I might have an irrational thought that my boss doesn't like me and is trying to get rid of me. As a therapist, we can challenge irrational thoughts. With this, it was a lot of sitting with people in difficult times and difficult, stressful emotions to say, yeah, like that's how this feels. I see you, I hear you. What are your options? What can you do? And uh and the good thing, so for anybody that hasn't heard, there a because the decisions were supposed to be made, I think they've just extended the deadline till February 10th or something. But there are legal concerns that the email you that it's not legal, and does the president have the ability to make this type of offer? Does he really even have the power to do that? And so there are unions, because there are some unionized federal employees. So unions have sued to stop this, and a federal judge has stepped in to put it on pause. And I do hope, and because mental health, so this would be a bad time to start cutting back on mental health providers, to start cutting back on medical advisors. And I'm just here to sit with you all and validate that yes, this is a lot. And so welcome to everybody that's watching. Once again, I just I wanted to provide this space where people can consider their options, and then they can also handle what's if anything does come. And with that being said, I work with some people that have been laid off, that are furloughed, because their agencies received federal funding, or people that are fearful that they may be furloughed if things come down the road. So, if you are a federal worker, if you are somebody that relies on federal funding, this is just a general tip, just general information to say, I would make sure that my resume was up to date just in case. I would make sure that's together. And if you're in the office and there's a lot of chatter, if there's a lot of and if it's increasing your anxiety, because the uncertainty of these situations can make a lot of what if questions come up, and what if questions that are out of my control. I really there's not that will just cause distress. But the what if, so like, okay, so what if something does happen to my job? Okay, well, I need to take a look at saving. I need to make sure my resume is up to date. I need to reach out to these things. And if something does happen, I encourage people, if they are leaving a position, to leave well. And what I mean by leaving well is to not, like, say, forget all y'all. I don't know, like, to leave well, because that manager, whoever is at that office, can be the one that writes your letter of recommendation, that can be there. And so there are good what ifs. So a good what if is, so I have another stream scheduled for 2 p.m. today. And so it's like, okay, well, what if this stream runs over? It'll be okay. And so, okay, I right now in this moment, I don't need to worry about if this stream runs into 2 p.m. Eastern. But if I heard a loud noise downstairs, and if I'm concerned about, my son or something, and once again, hit my husband's in the house too. Um, but I might pause the video if I need to go and check on something that's out of my eyesight. And thank y'all for the compliments on the hair. I skipped wash day, and so the curls are a little stretched. I skipped last Sunday. It was I just My son got sick last week. And so I skipped last week. Tomorrow's gonna be wash day. But And then if people do have to make adjustments, if people are impacted financially, to make sure to reach out to your landlord, to reach out to your mortgage company, that the worst thing to do is to just let missing payments come up, like to make sure that you're communicating, because there are some banks, there are some landlords, there are some options where people can pause payments, or they can um, ask for, to have a reduced plan, or sometimes there are options available if you ask. And so making sure to ask about those things. And then, so I, in a time of uncertainty, I wrote my book, Turning Crisis into Clarity: How to Survive or Thrive in the Midst of Uncertainty. I wrote this back in 2020, I think into 2021, because I would have never left my full-time cushy I loved working for the company that I used to work for. I talked before. I worked for them beginning in 2005, and then helped our new director launch the Fredericksburg office, and I loved my job. I loved being there, and it broke my heart to leave, and it took a whole pandemic for me to finally launch my own practice. And so my job went away, and I was driving back home talking to my mom, and my mom was talking about the chaos that can come in the midst of uncertainty. And just as we were talking, I was like, or people can find clarity. That sometimes in the midst of the storm, in the midst of the chaos, you have to first ground yourself. So you have to breathe, you have to stop, find your footing. And for some people, that might be spiritual. For some people, that might be their career or their family. Figure out what helps ground you, because paying attention to all the noise is just going to create confusion. It's going to create more stress. It's going to make it so you're not sleeping at night. It's going to start impacting your health. um, I recently had a physical, and I now have to monitor my blood pressure, and I'll find out in a few weeks, because if my doctor does recommend some type of blood pressure medication, I already know that I'm gonna, because I have some specific questions for my doctor if they do recommend blood pressure medication. And I thought I just had white coat syndrome. So my blood pressure, when they take it at the office, because I'm normally mad, like when I don't like going to the doctor. Most doctors, and I'm not a medical doctor, I'm a psychologist, but most doctors don't love going to the doctor. But I have a home blood pressure cuff, and my blood pressure has still been high. And so something that I'm doing in the midst of all that's going on is I need to focus on my health. And it's American Heart Month. I also got my annual mammogram as well. Everything came back clear and good for that. But making sure that in the midst of all of this, you first have to take care of you, especially if you're a parent, if you're a caregiver. And then, because normally the kids are gonna be okay, most of the kids, not all. So some kids will need extra support. I have some people that are in the midst of situations like this, and we started talking about, how do we tell the children that a parent lost their job or is gonna be looking for a new job? Because sometimes you need to communicate these things, because there's gonna be a change in the budget, or maybe the child is no longer gonna be in their, daycare, or maybe there are gonna be some changes and adjustments that happen within the family. And sometimes even reaching out to the daycare, sometimes they'll hold the spot without a payment, but sometimes they want that payment to hold the spot. And so making sure to communicate. Yeah, so Lisa, I normally ask them to take it twice. So my blood pressure is always highest when I first get there, and then they take it again. But that happened, because it happened But it was still pretty high, and even when I'm taking it at home, it's still high, so I'm like, "Ugh." So I'm preparing myself for the conversation with the doctor, and I'm also being mindful of my mental health. So right now, um, I'm not watching a lot of news. I have set aside 2 times a day. So in the morning at, um part of my morning routine is checking the written news, and then, later in the evening, I check as well. Because I'm a therapist, so sometimes my clients are saying, "Have you heard?" Or because they're talking about things that are distressing them, because there were different things that have happened that I hadn't even heard about. And so a lot of it has just been supporting people where they are. It can be a lot. Um, uh, uh Yeah, because somebody mentioned talking about tracking their blood pressure, because I have a piece of paper that I'm tracking it on, and, 'cause I'm doing it in the morning and at night. Normally, my morning is lower than night, but night, I'm taking it right after I've driven home from work, and so I'm trying to figure out things to just help have that balance. Balance is so important. So first, make sure to take care of you. Make sure that you're breathing. Adding in some type of physical activity if you can. If something does happen and if people do end up either losing a position or walking away from a position, grieving that loss. Because even if I don't like my job that much, if it ends and it wasn't my choice, there can still be a lot of grief that comes up with this. And then also there can be grief if I stay at the job and I have coworkers that are leaving, that can also bring up a lot. Something else that's happening is people are going to be going back into the office, and many of the offices are not prepared for it. I'm hearing directly from people at high levels to at every level that, many of the offices do not have enough desks, they do not have enough parking, they don't have enough space, and people are going to have to make adjustments to try to figure these things out. I will also say that if you're currently in therapy and if there is a mental health diagnosis, you can always talk with your therapist. If FMLA, or if you have a medical condition that impacts your ability to be in the office full time, if you have a family situation, let's say you're a caregiver to a child with significant medical needs, you can always talk with your HR department. These are just general tips. I can't give y'all specific advice, but sometimes telehealth can be, or sorry, telework, because I do telehealth as my, but telework can sometimes be a reasonable accommodation, even if it's a few days a week. And so people can talk and figure those things out. Many jobs offer what's called EAP. So it's the Employee Assistance Program, and that's often free therapy. Sometimes it's helpful to, if you are going to use your EAP benefits, to find a therapist that is in network with your medical insurance as well. So that once you finish your EAP sessions, if you wanted to continue with that therapist, that you could continue. But and a lot of people are grieving because federal work was often considered one of the most secure jobs. And I am for people, because I think sometimes even, like, once teachers get tenure, sometimes it's really hard to fire them. So I'm all about accountability, um, but what I personally don't feel is helpful is, when there's difficulty when there's a lack of communication, when things aren't really clear, and when we're having to kind of figure out things along the way. I know in my state, so I'm in Virginia, and my state is preparing if there are changes to the Board of Education or if there are changes to the Medicaid program, or if there are changes to the subsidies provided through the Affordable Care Act. These are things that people are preparing for and making sure to let your voice be heard and be known. So in Virginia, we have a very high number of federal workers, federal employees between Virginia, Maryland, DC. This area just has a lot of federal employees, and with that, um, there have been town halls by local leaders where people can have a safe space to talk about their concerns. For me, a meeting like that could be more frustrating because it's often just a meeting where we're all kind of talking at the same time. So I personally would probably call or email my my political representatives versus doing a big town hall, because it could just be very triggering, or it could be camaraderie. So for some people, that could be great to feel like I'm not the only one. I'm not the only one that feels this way. I'm not the only one that's struggling. And so finding ways to come together to meet with your community to really and then to not give up, to not lose hope, because I think that's what can really increase depression, and it can really just increase things. Now, I actively practice what's called radical acceptance. Radical acceptance is a DBT skill. I'm going to try to see if I can find a image for it. It comes out of a Buddhist tradition. Um, let's see. Do, do, do. All right. And the biggest part of radical acceptance is not fighting reality. Because one of the worst things I could do is be in the midst of a situation like this and be in denial. Be in, oh, like, it's fine. Everything's fine. I'm fine. Everything like and we're I'm not fine if I do need to make sure that I have the tools and and the things that I need. Acceptance isn't approval. So I can accept that something is happening. I can accept what's going on and still speak out about things that I might not agree with, or still make sure to actively work towards things. And so radical acceptance, it comes out of dialectical behavior therapy. And yes, it's that statement, it is what it is. It is what it is, and at the same time. So, radical acceptance, what it's trying to do is we're trying to, like I said, not fight the reality. So, I'm in the midst of a pouring rain, and instead of, like, being stuck in the, "Ugh, I can't believe it's raining," but it's like, "Okay, it's raining. Now what? Now what am I gonna do? Okay, I'm in the midst of a pouring rain. I'm in the midst of a storm. Now what can I do?" Instead of getting mad at the rain, instead of focusing myself on something that I don't have any control or any power over. So, the other thing that I would encourage is for people to focus on what is in their control. And I think having a plan. I think it is important, especially if people if their job is funded heavily focused on federal funding, making sure to have plans in place. I haven't done my analysis yet of how many of my clients are Medicaid funded. I'm not scared that like everyone will lose Medicaid funding. I am concerned about just some of the things that help make things more affordable. I am concerned just that some of these supports for people that are currently there, what's gonna happen to that? And, getting your therapist. So, I'm laughing not because it's like y'all know I laugh to cope, and, it's a good time to be a therapist right now. I am literally having people show up to the office looking for help, and my practice is fully booked. I'm not able to take them on. I direct them to Psychology Today, Therapy Den, Open Path Collective. There are still community centers, community resources. If people do lose their insurance, checking out what other options they have, because one of the leading causes of people, having to file for bankruptcy is medical debt, and it's often people with insurance because even with insurance, depending on people's plans, they can still end up in exorbitant medical debt, but, it's a lot. If y'all have questions, if you're like, "Please, if you could talk about this, if you could talk about coping with changes with this," please make sure to reach out, and, um, continuing to connect and build community. I will be here sharing twice a week, and, next, we're gonna talk about Kanye West and, the little Grammy incident. Somebody asked me to talk about that, and I wanna talk about boundaries and, healthy versus unhealthy submission or dominance in relationships, so that's where we're going next. If you don't wanna be redirected to that video, please enjoy the rest of your day. Hey, mama. And I will see y'all in the next video. I hope y'all have a good one. Bye.